Our next speaker is Ligia Kornowska, Managing Director of Polish Hospital Federation, Chairperson of the Board at Data Lake and leader in AI in medicine, telemedicine, and medical data. Experienced startup manager, investor, and consultant, helping to drive digital transformation in healthcare. How AI is changing healthcare in Poland and CEE region. How can we implement AI solutions in health entities successfully? What are the obstacles? What will the future of healthcare look like? Ligia, the stage is yours.
So hi, thank you for the invitation to this conference. My name is Ligia Kornowska and I run a number of projects when it comes to artificial intelligence and sharing medical data for R&D purposes. So my main topic today is how may I or AI help you, but I promise you that by the end of the presentation I will tell you about the successful implementation of opening access to medical data for R&D projects. I believe that you will be interested in it. So 2 words about organizations that I represent. Polish Hospital Federation is the biggest hospital organization in Poland. We associate together around 550 hospitals. We are part of International Hospital Federation and European Hospital Federation. And we are actually quite active when it comes to innovations in healthcare. We were one of the co-creators of AI in Health Coalition. This is a group that associates more than 100 organizations like technological companies, startups, but also patients' organizations or medical universities. And we all aim on successful and safe implementation of AI and innovative technologies in healthcare. So you probably will agree with me that we are now facing 4th industrial revolution. But what we see is actually we even have our own ludists as it was in the previous industrial revolution. A couple of months ago, that was an official letter to stop development of ChatGPT. So I believe that it's a great example for what is going on right now when it comes to huge changes, huge industrial changes. Second question is, what is artificial intelligence? And I don't want to deep dive here in definition, but I want to say that we actually can understand AI as artificial intelligence, but also augmented intelligence, and I think that it's more appropriate. But we can also talk about IA, intelligent assistant, which is very, very appropriate because now we use AI as a help for us, for example, in medical field. But what's important here? There were a number people tried to define artificial intelligence, define as something that thinks like a human. But I wanted to tell you actually that, and we have this Lebner Prize for the artificial intelligence that will best imitate human behavior. But we also actually know, all of us know about these, little things. I'm not a robot, it's CAPTCHA. And we have number of research that actually AI is better than us in clicking I'm not a robot. And CAPTCHA stands for completely automated Turing test to tell computers and human apart. So actually AI is passing exam on not being a computer. So it may be a little bit scary actually. When it comes to medical field, there is number of medical devices officially registered that use artificial intelligence. What's important here that every AI algorithm that may be used in diagnostic or treatment path of patient should have an official registration. In Europe, this is a CE certificate. In the United States, it's an FDA. So we see a growing number of these AI algorithms that are officially registered in Europe and in the United States. I actually checked like 2 weeks ago that that was a new FDA article that they have like 30 new algorithms accepted every month now. So the growth is actually exponential. When it comes to medical fields, of course, the most popular one is radiology. Like this is a queen of artificial intelligence. But we have also algorithms in cardiology, but in this kind of human specialization like psychiatry too. So AI can help actually across the whole medical sector. 3 examples that I like to talk about because first example is actually about AI algorithm that can diagnose by itself without medical doctor's approval. And this algorithm was accepted and approved 5 years ago. So I don't know if we still may say that it's an innovation, right? So this is an algorithm about telling based on an eye examination if there is a retinopathy or there is not, based on the medical images. And this algorithm can do it without physician's stamp on it. Second example is about the standard AI algorithm that we know, that we often hear about, the AI algorithm that helps physicians to diagnose better. And only one algorithm used in breast cancer field can lower false negative results. So the situation that women have breast cancer, but it is not seen by the radiologist on medical images. So it can lower false negative results by 9.7%. So it's a lot. It's potential like hundreds of thousands of lives and lives with being health saved. And third example is actually example of AI that can diagnose in the way that is impossible for humans. So Lancet Digital Health published 1 year ago, I believe, the research about AI algorithm that could diagnose anemia, so the problem with your health when you have like problem with your blood cells. And it actually based this information on ECG diagram. So right now, no physician will tell you that you have anemia based on ECG diagram. You have to do laboratory tests to know that. And this ECG was like, had accuracy of 80-something%. So we don't know yet why did it tell the patient has anemia based on ECG, but it was accurate. So definitely we need to do more research in this field. There are newer examples, and we often, in Poland, but not only in Poland, we often say that ChatGPT won't be used instead of a medical doctor because it's a computer, right? And we actually see that there are tests that shows that ChatGPT is actually almost 10 times more empathetic than medical doctors. So it's not a best information for us. I actually spoke with one of the patients' organization president, and she told me, look, I put all the information in ChatGPT and I had like 100 questions about my illness, and I told to ChatGPT that, look, I'm sorry that I am asking you so much questions, and ChatGPT responded that, oh, no, not at all, don't be sorry, I'm here to help you. And she was like, oh my gosh, I have never heard it from my medical doctor. So it may be a sign for us to think about. In Poland and in CEE region, we actually 4 years ago we started to list all the medical innovative startups that operate in Poland, and for 2 years we now list startups from all the CEE region that are creating or using technologies, innovative technologies in healthcare sector. And this year we gathered 150 startups. What is very interesting, 60% of them are in AI, and like 4 years ago there was only like 20 or 30%, so we can see this exponential growth again. Telemedicine is not so popular as it was a couple of years ago, but 34% of startups work in this field. And most of the startups work in oncology or cardiology. These were two medical specializations that absolutely won the contest. And what is very interesting here, we have number of statistics in this report, so if you are interested in more data, please type top disruptors in healthcare. You can download English version of the report. But what is really interesting is that actually for the most startups, medical doctor is an end user of their solution. But for the most startups, the paying customer is actually hospital. So we have the situation that end user is not actually a paying client, and it may be, because of that, it may be difficult or more difficult to implement AI solutions in the healthcare sector. So we had the 60% of startups that work in AI, but when it comes to Poland, only or maybe it's a high number, 6.6% of hospitals use AI solutions in their daily practice. So this was a number from last year. 2 years ago, it was actually like 2% or something. So we see this growth. We can talk about if it is high or if it's not high, but actually it's a good sign that it's becoming more and more popular to use AI solutions. And some examples from Poland when it comes to Polish solutions. These are only a couple of them, but I choose them because they are implemented in number of medical entities. One is this electronic stethoscope that allows for AI analysis of the sounds that we hear. Toki AI is a startup that actually creates AI for registration, so it allows to answer 100% of calls to the hospital or to medical entity. It actually is implemented in 100 medical entities, but it actually started cooperation with one of our biggest hospital information system providers a couple of days ago. We have 3 solutions when it comes to HoloLens imaging and augmented reality. So the possibility for medical doctor, for surgeon, to wear glasses and to see the reality, see the patient on at the theater, and actually when he look up, he can see, for example, CT scans or MRI scans in 3D, and it looks like this futuristic and a little bit funny when he does like something like this, but it's really helpful for when it comes to preparation to surgery or during surgery. And we had some startups that operates in that creates AI for diagnosing and helping pathomorphologists to analyze biosamples. And Clebre is actually about analyzing sleep problems, and they also uses AI for it. So we have a number of different examples. It's not all of them, of course. But what's very important, I always show this slide when somebody asks me if AI will replace doctors, and I respond, look, AI cannot tell Chihuahua and muffins apart. Actually, it's very hard for AI to do that. So there are some obvious challenges, and unfortunately, I actually had to update this slide because ChatGPT can tell Chihuahua and muffins apart. It's like for a couple of weeks now, but probably not because it's so good at like this vision analysis, but it's just like, you know, downloaded some information from the internet that, you know, this is dog, this is muffin, because if we change the location of dog and muffin, it cannot tell them apart again. There are some more serious problems. For example, a problem with AI black box. So the problem that we know that AI is, for example, that has high accuracy, but we don't know actually why AI is making this diagnosis. And we have, of course, problem with data bias. So if we use, for example, data about males when it comes to medical research and use this data to train AI algorithm, it can turn out that this algorithm is totally wrong when we treat women with this AI algorithm, or children, right? So based on patients groups that we train our AI algorithm, it can be more or less accurate. There are some hidden challenges for AI. For example, and I really like this medical research, because I always hear that there is no problem with AI algorithm, because most of the AI algorithm are used only to help a physician to make a diagnosis. But actually, it was proven that if medical doctor, for example, radiologists, while analyzing X-ray scans, diagnose from AI and then create his or her own diagnose, it turns out that if they saw accurate diagnose, the final diagnose will be accurate. But if they see wrong comment from AI or wrong diagnosis from AI, the final diagnosis will be much less accurate than this diagnosis made by their own. So even if AI is only helping physicians to make a decision, we have to be sure that this AI is accurate. So I don't see time here, and I don't want, I have many slides. Okay, so I believe around 10 minutes? Sorry? 13 minutes, great. So what we did in Poland as an AI in Health Coalition, but also number of organizations, including Ministry of Health or Patients Ombudsman Office, we created white paper on AI in clinical practice. And this is like one of the first of its kind for this part of Europe. This document tells us how to implement AI safely and answers the most pressing questions. And it's also available to download from our website, so please feel free to download it and check it. So I will answer only one question here. If you are interested in more questions and answers, you can check it by yourself. But this is the most important one, because we had like 3 months of discussion if AI can diagnose by itself. And from the one point of view, we knew that when it comes to giving a diagnosis, we have a regulation that actually tells that it has to be physician or medical professional to give you a proper diagnosis, right? So it's impossible for AI, like in legal way, to give you a diagnosis. But in the same time, we knew about this algorithm approved like 5 years ago that actually give you kind of a diagnosis without physician's approval. So we didn't know how to actually answer this question. And the answer is really simple, but yet powerful, I believe, because we treated AI as any other medical device that shows us some results. For example, if you have diabetes and you go to the medical laboratory and you get test results from your blood sample, you can base on this test results and go to the doctor or no, not to go to the doctor, or take more insulin or less insulin. So this is an information that can influence your diagnostic and treatment path. And even if you are only checking if you have diabetes and you get the result that actually is 1-to-1 diabetes, right? More than 200 milligram percent, it's like 1-to-1 you have diabetes. You don't have this diagnosis given by the laboratory, even if it is giving you a result, it is confirmed by medical doctor. So we believe that every information that AI give, it's not a diagnosis, but it may influence diagnostic and treatment path of patient, and it's the same result as we have from laboratories. But there are other issues with AI. There is a lot of issues with AI that we have to answer. For example, how should we act if AI give one diagnosis and medical doctor think the diagnosis is different, especially in the, for example, oncology field? We don't know, or we have an idea because we put it in our white paper, but there are some questions about patients' rights and how to respect patients' rights. Should we inform patients about using AI? Should we ask them about consents? Who is responsible for AI? And what about this AI black box? Can we use AI if we don't know for 100% sure how it works, like inside? And more and more and more questions. Every question that I show you here is answered in our book. So this is like a guidebook how to use AI for our hospitals and for physicians, and we share it. So please check it out. And the last thing that I actually promised you, because talking about AI, we cannot not mentioning the problem with accessing medical data. There is no AI without medical, there is no medical AI without medical data, and the access to this to data is really challenging, because from the one point of view, we have researchers and companies that need access to this data for R&D purposes to make medicine more and more advanced. But from the other point of view, we have patients that are not exactly willing, for example, to compromise their privacy. We have general data protection regulation in Europe, in European Union. And we actually know what may go wrong if we use data without, proper respect towards this data. So we actually, in Poland, we started this project under Data Governance Act. This is a new European regulation. Project is about opening access to medical data based on patients' consent for sharing their medical data for R&D purposes. So we actually created a Donate Your Data Foundation that is asking patients for giving their consent for using their data for medical research. Patient can always log into the IT platform that we created with our technological partner Data Lake, and they can always withdraw consent. They can also give consent again, and they can do it online. We are integrated with identity verification provider, and they can actually see the whole list of operations on this consent, so they may be sure that if they withdraw consent, no one will use their data, because it's written on this new technology that actually don't allow us to rewrite or manipulate this information. And we started this project a couple of months ago. We have now a huge project in cooperation with Novartis under our medical research agency. This is a part of organization under Ministry of Health. That is, for example, about breast cancer patients. We collect medical data and analyze it to show what is the diagnostic and treatment path of women with breast cancer. So if they were diagnosed quickly, what kind of treatment did they get, was it in line with newest medical standard. But we also share data with AI companies, with startups, and we help them to create their own AI algorithm that may be really beneficial in healthcare sector. Our other activities, we are very active in Poland. We have number of projects, white paper, but also other reports. In Europe, we are involved with number of cooperation. For example, this Data Governance Act, we cooperate with DG Connect, which is a team under European Commission that is responsible for Data Governance Act, and worldwide we are part of couple of organizations. So thank you for your time. This is a contact to me, this is my LinkedIn. If you are interested, please contact me, and I am waiting for your questions.
Is it free for startups, for example, to access this data you talked about?
Unfortunately not, because we have to, it is the same way as when it comes to blood donation. So for example, like startups or every company who access data has to pay for it, but the payment goes to hospitals and to patients, but not in the form of money, but in the form of healthcare benefits, like discounts on Nutri-Drinks, discounts or on medical appointments. But we actually implemented the whole policy that tells us that if we deal with smaller companies, the amount of the payment for data should be lower, and if we deal with non-commercial organizations and, for example, research groups or universities that need this data for non-commercial purposes, we give it either for free or with very small payment to provide, this data in a secure way. Okay, so there is, I believe, no legal definition of owner under GDPR, but there is a data controller. So the organization that actually may have data legally and process this data. So data controller may be Donate Your Data Foundation, and we do number of projects as a foundation, but data controller can be also a hospital, a medical scientific committee, or other organization. We try not to collect consents for commercial companies to not, to be more transparent about sharing data. That's why we are more willing to cooperate with NGOs and this, like non-commercial organizations.
Thank you.
Hello, thank you for a great talk. Ramzi Timani from Johnson & Johnson. I'm leading an initiative called AI for Systems Biology. I had a question because you're sitting on both sides, on the AI side, on the hospital network. What is the mechanism to facilitate the interaction between the ecosystem of AI and the ecosystem of hospital, knowing also that each hospital have their own information system, their own IT, and there's a complexity on normalizing and standardizing the data. So how do you manage putting things together to make sure that the startup or the ecosystem can access the data? And is there also a link with the medical doctor? Because AI, whatever data you feed to the model, you get results. But one of the challenge, how to validate the outcome. So is there also doctor involved in reviewing the outcome of these models?
Oh, thank you. That were great questions. I will try to answer it. So when it comes to accessing medical data in hospitals and sharing it with others, we have of course, we have a problem with lack of interoperability, and we have 4 or 5 main hospital information system providers that are really not willing to integrate with other solutions. it may be a problem. But we have also a standard of medical documentation, which is HL7 CDA third version. Not all of the hospitals comply with that standard, and it's not perfect because, you know, like we have some of the data is structured. For example, ICD-9, ICD-10. Laboratory test results. We have also e-prescription system, like nationwide e-prescription system, so every information about prescription is also in a structured way. But
is it using ontologies? Because again, like my other question is,
yes,
like, because
yes,
probably
yes.
it's in Polish, so how would you make it available to the wider community?
When it comes to e-prescriptions?
No, I mean, like, if the data is stored, so sometimes there's notes that are taken in written language. So if you have an ontology, you could basically take in the terms and convert to other language. So is that the case?
Yes, so right now we are not doing that, unfortunately. From my knowledge, there is no NLP that would allow us to create ontology based on Polish medical language. So it's still a huge challenge to, you know, take from the medical notes, medical written notes, the information, for example, about very specific chemotherapy that is, for example, administered for patient. What we do is we secure like legal right to this data. So based on this consent, we are sure that hospital has to share this data with us. And 86 or 89% hospitals in Poland use electronic medical records. So even if we are not integrated with them, or some of the data is not in a structured way, we still can get the data in this, you know, HL7 CDA third version format. And this is enough for us to base our analysis on it. For example, when it comes to this project with Novartis, we actually collect the data and we check like half automatically, half manually what is written in these medical notes, because we are collecting information, what is the treatment administered for patient. And we can do it based on this HL7 format, but it's not automatic, right? It needs a lot of time and time and work. So it's not perfect. And when it comes to AI algorithm validation, it's a great question, because one thing that we didn't put in a white paper, or we didn't resolve in white paper, was an AI certification. And when it comes to Europe, new medical device regulation is a little bit better than previous one, but it's not fit for AI algorithm. So we actually don't know if we should compare AI algorithm to one doctor, or to 5 doctors, or to specialist, or to intern, or to whom. Or we don't know how much data should we put in AI algorithm to know that it is sufficient. For example, is 1,000 medical records enough? 10,000 it's enough? Like, we don't know it yet. And this is an issue that should be resolved on a European level. But we have some actions that we can see from our medical association. For example, cardiology association. We have like the person who is responsible for it in Poland and has a position in Europe also. They actually are trying to set up a guidelines on medical research on AI. So they are like a step. They are before certification, right? So they are trying to tell, look, if you are validating AI algorithm, you should compare it to this kind of specialist or something like that. But it's still very early stages, so this is a problem. And even if we have AI algorithms that are certificated, our hospitals, the main problem is that they don't know if it is validated on Polish data and in Polish medical practice. So the validation, like true validation after certification, is a problem for Polish hospitals, and that's why, for example, Medical Research Agency creates some public funding for validation.
Thank you.
Thank you.
Ligia, thank you so much for this very
you.
insightful talk. Here's your certificate of appreciation for your engagement in DSC 23. Thank you.
Thank you.